Hello and welcome to my podcast. My name is Isabella Sankey. Today, I will be looking into how much damage has the Syrian conflict caused to its healthcare system and can it be rebuilt? Before we begin, this episode may contain some information that listeners find distressing. In March 2011, the civilians of Syria began peaceful protests regarding the political and economic situation. After a decade of destruction, attacks on Syria's healthcare have been relentless, leaving it decimated. The World Health Organization have published that 70% of all worldwide attacks on the healthcare facilities and workers have occurred within Syria. 10 years later, the conflict continues and the healthcare system in Syria is on the brink of collapse. It is thought that over 400,000 people have died, and in 2014, the United Nations declared that they were unable to continue counting deaths due to the chaotic conditions which have been inflicted because of the conflict.
But in this decade of conflict, none has been more sickening than the deliberate targeting of hospitals. War crimes committed weekly, where buildings which should be sanctuaries have been plunged onto the front lines.
They just hit the hospital.
As the bombs were falling outside, Samia was brought to the Aleppo hospital. She was struggling to breathe and her skin was burning. Along with dozens of others, the 2-year-old was given oxygen. She could hardly see, but it wasn't just fear in her eyes. The doctors said she'd been poisoned in a chlorine gas attack.
More than 100,000 people have died in Syria's civil war since it began in early 2011. That's according to the United Nations. Millions have fled the country or have been made homeless as a result of the conflict.
Now, leading doctors from around the world are warning the war is having a huge impact on the country's healthcare system. They say it's on the brink of collapse due to damaged medical centres and doctors having to flee.
Over the last decade, the Syrian conflict has raged. What started out as peaceful protests and demonstrations has led to a calamity for the country, and in particular the healthcare system. Syria is a country in the Middle East which borders Israel, Lebanon and Iraq. All are countries who have experienced civil unrest. Before the conflict began in Syria, there was a high percentage of unemployment, corruption and an absence of political freedom under the power of President Bashar al-Assad. He won the vote in 2000 after his father Hafez passed away by winning 99.7% of the vote in favour of him becoming the next president. Before he relocated to Syria, Dr. Bashar worked at an eye hospital in London in the early 1990s as an ophthalmologist. However, instead of being a doctor who was trained to save lives, he decided to kill, awarding himself with the title, the world's most notorious war criminal, with 104 people killed by his order in April 2021.
Syrian security forces have opened fire on protesters with reports of between 20 and 100 people dead.
After the original demonstrations and peaceful protests which erupted in the southern city of Deraa, soon many neighbouring cities had joined the fight. As the unrest spread throughout the country demanding Assad to resign, other countries began to take sides by deploying fighters, sending money and weapons. In Syria, Assad still had the support of people who then began to fight against the protesters. In July 2012, the International Red Cross declared that due to the spread of violence throughout Syria, it was now a civil war. Extremist jihadi organisations such as the Islamic State and Al-Qaeda also joined in with the fighting alongside the rebels and the Assad regime. This was seen as a huge threat internationally. The Syrian government have now been supported by Russia and Iran, who have helped to carry out airstrikes, some of which have bombed the hospitals, while Saudi Arabia, Turkey and the US have supported the rebels along with other Western countries such as the UK, who have provided moderate support. The Syrian Observatory for Human Rights have documented the deaths and people missing to account for 500,000 people, with the Syrian government being accountable for over 150,000 of these. The Geneva Convention is a series of rules which apply in times of armed conflict and seeks to protect people. It forms the core of international humanitarian law, which is there to provide protection of all those injured and to all those receiving treatment in a war zone. However, this has been ignored in the Syrian conflict, and the war crimes such as murder, torture, rape, and enforced disappearances have been found in a UN commission. All parties which were involved in the conflict have been accused of blocking access to the water, food, and health services during the sieges. In the first 6 years of conflict, there were more than 450 attacks on hospitals by the Syrian regime. Before the conflict, Syria had a population of 17.5 million people, but since 2011, over 12.3 million civilians have been displaced, which is 71%. This has become the world's largest displacement crisis. The International Rescue Committee published that the Syrian conflict is third on the annual emergency watch list. When analysing the effect of the conflict on Syria's healthcare system, it was really important to compare the state of the healthcare system before the conflict began in 2011 to now. Before, the healthcare system was already struggling. There was a lack of communication within the healthcare system, and subsequently it had become fragmented and politicised. The primary healthcare system was underdeveloped, and as the country became divided due to the support of Assad, the healthcare system became more privatised, with an increase in specialist hospital care. However, this meant that the poorer people in Syria were discriminated against as they couldn't afford the healthcare. The healthcare system was then weaponised by the regime. Government-run hospitals functioned as an extension of the security apparatus, and it was reported that staff still loyal to Assad would routinely deal with minor injuries. However, they carried out amputations as a form of punishment, and protesters who were wounded and waiting for treatment were taken off the wards and either tortured or killed. This conflict has only exacerbated the healthcare system situation before. It has led to over 70% of healthcare professionals fleeing the country to find safety and security, and many have been employed by our own NHS and other healthcare systems in Western countries. It is unknown if they will ever return to Syria. For me, when I watched For Summer on Channel 4, and if you haven't already watched it, I would strongly encourage you to do so. It is the most incredible documentary that captures the brutal reality of the situation in Syria currently from my mother's perspective. After watching it, one of the things I couldn't stop thinking about was how the conflict is affecting the Syrian civilians' mental health, but especially the children, who are witnessing deaths, constant bombings and unimaginable things on a daily basis. I'm so glad to be able to welcome Dr. Ala El-Khani. She is a humanitarian psychologist who is a consultant for the United Nations Office on Drugs and Crime. Alongside this, she works for the University of Manchester, specialising in mental health and psychology. Ala has been working closely with NGOs in refugee camps to support families who have experienced conflict and provide parents with the support they so desperately need so that they can help their children overcome the trauma of events they have been surrounded by. Along with the rest of her team, Ala has devised programmes which have helped teachers, NGOs and affected families internationally with skills in countries such as Lebanon, Syria, Afghanistan and Palestine. Today, she is going to talk about the mental health side of the Syrian healthcare system. Hello, Ala, welcome. Thank you so much for coming to talk to me today, all about the mental health system in Syria.
My absolute pleasure. It's lovely to talk to you.
So to begin, could you describe the quality of the mental health provision in Syria before the conflict compared to now, and how does it vary by region?
The mental health support in Syria has always been really poor. And I wouldn't just say in Syria, I think the Middle East generally, and I think a lot of developing countries as well. So there were only very few psychiatrists or psychiatric institutions. And it would often be only people who were severely psychologically challenged who would then be institutionalized, rather than having access to therapy for things that like depression, or other kind of more challenging issues. So it was always a massive challenge anyway. And when the conflict came, and it just shredded even that to bits as well. So it was already really bad. And I think at the time of conflict, there was a piece I read where there was only about, I think, 25 psychiatrists in the whole of Damascus. I don't know how true that is, but that's very, very few. So it's nothing, it's nowhere near comparable to what you'd find in the UK, for example. And bearing in mind too that the cultural issues of psychological challenges in Arab culture, it's not something that you would talk about really comfortably and say, you know what, I'm facing depression, or I'm hearing voices. There's a big cultural stigma around that. So that would stop people from seeking support as well. And that still exists till now. You wouldn't want to be labeled as crazy, which is often what could happen if you said you were experiencing psychological challenges. So things like postnatal depression or any kind of depression or psychiatric issues, they're not things that you would commonly hear of in day-to-day conversations in Syrian culture, for example. So it would only be if you were really, really struggling and your family were aware, and that's kind of when you have major mental health issues, would you then be facing a doctor or a psychiatrist, and then it would be often medication or being institutionalized, but not much access at all.
As and when this conflict does subside, or if it continues to progress, do you think that because of the work that people like yourself are doing and helping people to support each other and their children, the stigma around mental health and its treatment will reduce?
The conflict has fragmented the already very, very light and missing mental health response in Syria. But what has happened, kind of maybe the rainbow in this really, really bleak picture, is people are finding really innovative ways of supporting people who are both internally displaced and who are refugees. For example, telemedicine now is becoming so common. Telemedicine with regard to linking people up who are in refugee camps or who are being identified in maybe conflict zones, and linking them to people all around the world who are volunteering their time in the UK and in America, for example. And there's kind of this almost like these counseling sessions or advice and so on. So I think this is bringing far more awareness to any response, particularly to the Syrian response, of what needs to be done. And I think this will continue to be led by needs. As the conflict continues, we've now kind of crossed the 10-year mark, sadly. Psychological and the needs are becoming far more obvious. So there will have to be a stronger mental health response, particularly with the international organizations really heavily involved. And it will be kind of on many levels. It will be kind of on the really basic levels of kind of trying to normalize the challenges that people are facing psychologically. And then it will be more kind of group work, and then there'll be more one-to-one support that hopefully will be able to become available. So there are different ways that I think psychological response will become more common in Syria. I think it will take years and far more work before we get to the stage of everyone being able to access, one-to-one support where needed. But on the more simpler level, there's far more awareness of the needs that people are experiencing and how to respond to that.
How do you think the UN are responding to this? Do you think that they are listening to what you are advising, and how determined are they to make a difference by implementing these various different strategies?
Absolutely. So there's prevention work, and then there's kind of treatment work. And what we know in prevention science is I think it's something like $1 of prevention work saves you $6 on the other end. So there's so much good that you can do from supporting people in the very early stages of going through conflict and displacement. So the more work we do at the very early stages, the less work we will do to need to treat people who are really suffering and haven't had support earlier on. And I think there is a lot of recognition of that globally now. International organizations are really heavily pushing psychosocial work, are really pushing trauma recovery work. So there are a lot of really good things coming out more recently. I mean, when I started in this area over 10 years ago, we were like still trying to discover or research, what do families need during conflict and displacement? In the last few years, we've got tons of articles and research pieces and books written and all sorts that tell us exactly what people need in this context. So now we know what we need to do, and people are investing in this need. International organizations, the UN, UNICEF, WHO, many international organizations are really, really pushing to support.
How instrumental have NGOs been in helping to deliver these ideas, one of which being the leaflet you helped create, which advises parents on how best to support their children, and an NGO had the idea to deliver to families via their daily bread package in the refugee camp, which resulted in a huge success and uptake?
Yes, yeah. So NGOs have been really, really important for a number of levels. They're the ones who are really in the field on the ground.
Yeah.
And it's all great having these great ideas of what you want to do or how you want to reach families, but actually it's the NGOs on the ground who can tell you that this is feasible or not. So when we wanted to reach families, for example, with really simple parenting information, we were like, how can we do that? Do we reach them through schools? Do we reach them on a one-to-one level? And then it was speaking to an NGO worker who's like, well, distribute X thousand amount of bread via our bakeries in conflict zones. Why don't you add your leaflets into these bread wrappers, and then you could get 3,000 out in 3 days, for example. So it's really important to make these close links with the NGOs on the ground. And sometimes they're really, really small NGOs, and every pence you donate to them will be used exactly for the project that you want to support. Often when people make donations to really large organizations, you don't really know where your money is going, but it's the smaller NGOs who are on the ground that can be, particularly in the context of Syria. Smaller NGOs are the ones really who are doing a lot of the moving, of making things happen on the ground. And even some of the larger organizations rely very heavily on these smaller NGOs that do a lot of the implementation fieldwork.
As someone who has never been to Syria and has only witnessed the conflict from coverage that has been recorded and broadcast on Western news channels, I feel there is a lot of coverage on the physical injuries to people, but not their mental health. In terms of funding, does this mean that most of the money donated is disproportionately allocated to treating the physical injuries rather than the mental health of civilians?
For sure, the mental health support is a tiny chunk of the physical well-being part, and also the physical health, I think, people are far more invested in that. You can see when you do an operation and you change someone's life that way. You can't really see when you're offering counseling or any other kind of psychological support in the beginning. So I think far more is invested for sure in physical well-being, but still, over the last few years, a lot more is being invested in mental health, but a lot more needs to be invested in mental health too.
Looking towards the future, what do you think it will take to re-establish the mental health services in Syria? Or do you think too much has already been lost and too many healthcare professionals have left the country?
I think the challenges will be the same challenges as physical health. We need years and years and years to come where the country is safe enough to draw doctors and therapists and psychologists back. A lot of them have left, but a lot of them too are people who have faced the conflict. So a lot of people now who are doing incredible psychological work are university graduates, are volunteers, are people who this wasn't their background anyway, and they're doing incredible work as well. So it will take years and years for the Syrian framework to be able to hold the correct capacity that the mental health needs requires. But I don't think that will be the biggest impediment, because there is a lot of international support as well. So I think I wouldn't be holding my breath waiting for the Syrian government to change what it's doing when it comes to mental health, to improve the mental health context. I think we need to continue to connect with international partners to make sure that the work is getting done, because a lot of the work now is international partners. So there's UNICEF, there's the UNHCR, WHO, the United Nations, organizations like War Child. So these are the big organizations that have years of experience in this area, and have many resources on all the different levels that I spoke to you about, kind of the lower, more basic information, all the way to the one-to-one step service. So these are the kind of organizations that are addressing the needs and meeting the needs in all parts of the Syrian context, both inside Syria and the refugees who are now further spread around the world.
I would just like to say a huge thank you for coming today and sharing all the incredible work you're doing and how the conflict has impacted the mental health care in Syria. Thank you so much.
Thank you so much, Izzy.
When watching news broadcasts or receiving news updates on your phone, you are bound to have seen videos and photos of the images of Syrian hospitals which are trying to deal with the constant influx of patients who have been seriously wounded. Relating to this, you may have heard of David Nott. He is the author of the Sunday Times #1 bestseller War Doctor, in which he shares his stories of treating patients in conflict zones, including Syria. After his countless missions to war zones to help treat patients on the front line, his wife, Ellie Nott, in 2015, had the idea of setting up the David Nott Foundation. My next guest is Dr. Ammar Darwish. He has worked shoulder to shoulder with David and accompanied him on their many missions to help treat and train surgeons to be able to deal with complex war injuries. He was born and brought up in Syria before moving to the UK to start his training to become a surgeon. He currently works in the Manchester Royal Infirmary, which is one of the NHS Foundation's biggest trusts. It is also a trauma centre. For 15 years, Ammar has been doing humanitarian work, but this has only become more intense since the Syrian uprising in 2011. I'm so glad to be able to welcome Ammar and to hear about his first-hand experience of working on the front line in Syria as a doctor.
Thank you very much for having me.
Thank you so much for coming. So, before the conflict began in 2011, how would you describe the quality of Syrian healthcare and how did it vary by region? Was it well funded and well equipped?
Very good question. Before the conflict started in 2011, the health system, you have the state health system and you have the private health system. And the state health system is very poorly funded. It's not like the NHS here. People go there because they can't pay and they cannot afford the private health system. And there's a shortage of equipment, medicines, although after a few years, just before the conflict, the Syrian government started to produce local medicines there. But these medication and drugs were not effective at all. They basically didn't have, like antibiotics, didn't have the desired effect that we normally have here with our antibiotics that we use in the West. So the health system there, you have It's the state hospitals are free, but again, it's not very good standards, not to the standards that we have here. And someone might go there to the hospital to have an operation, and someone will operate on him, a surgeon who's a very junior surgeon, maybe he's not done this operation before, and they operate on them just because they cannot afford to go to the private sector. If you have the money, if you have the connection, then you'll be able to afford to go to a private sector. And again, the private sector, some of them are reasonable, some of them are very pricey because they provide very high standards. Most of the Syrian people are average people, cannot afford private sector or private healthcare. And most of the Syrian people, they have at least 2 jobs a day to be able to afford a living, pay their rent, feed their children, educate them, and continue their lives. So it's really difficult situation before the conflict started, but it was manageable in one way or another.
And with that in mind, how has the conflict exacerbated this further, and how damaged is the healthcare system as a result of the war and the sanctions imposed, and how has this varied by region?
Again, it's gone from bad to worse, to be honest. With any kind of war, there's a lot of collateral damage, there's a lot of suffering. People will suffer, the normal people will suffer the most, because the people in hierarchies, in big or high positions of the government, they've got what they need, they're protected, but the normal people, the people who are the individuals who are doing their best to try and survive, these are the people who suffer. So during the conflict until now, the health system almost collapsed. And I'm going to tell you about the health system under the government or under the regime control, and the health system which is under the opposition or non-governmental areas, which are not controlled by the government. The governmental areas, the picture that I just described to you before 2011, before the conflict started, has gone worse, because these hospitals now are controlled by the army. They get their own people, the injured soldiers to be treated, and the normal individuals, normal civilians, they are the last to be treated, and they suffer a lot. Prices has gone up. These people have after 10 years of conflict, most of their livelihood has been destroyed. Most of their businesses are gone. Most of their savings are not there anymore. So really for them to go and pay for private healthcare is now impossible. And like I said, the hospitals overrun now by all the military. They take most of the injured people. There's no training to the doctors for the last 10 years because of the conflict. The same doctors, they have not improved their skills. And unfortunately, is the Syrian normal individual civilians are suffering more and more. On the other hand, when you look at the opposition side, which is non-governmental cities who have been is not being controlled by the government, as soon as the people started to uprise against the oppression of the regime and wanted their basic human rights of, fair health system, fair social system, to be able to have their basic human rights, the government pulled out of these areas and then started put the army and started to attack them and started a military assault on these areas. So as soon as the government pulled out, the health system in these cities, one of them is Aleppo, Idlib in the northwest of Syria, in the northeast of Syria, the health system collapsed completely. There were no health system. Doctors had to leave. Most of them had to leave. Only a handful of people stayed in each small town or city to try and help the remaining people or the civilians in these cities. And then this is when the Syrian diaspora living abroad, like the Syrian community here in Manchester and in London, got together, started their humanitarian work, started to do charities like Syria Relief, like Watan, which are British Syrian charities, have been doing a lot of work in the last 10 years. So these charities started to get donation and try and replace the collapsed health system and started to support these hospitals, clinics, and try to provide to these people who've been bombed day in and day out, airstrikes, military shelling, artillery shelling, and all that. So they started to bring charitable fund to try and support these health system. But again, it's still very basic. It does provide emergency work. It does provide operations for the wounded and for the war victims. But then you look at the other aspect, which is the chronic diseases, diabetes, hypertension, heart disease. They all have fallen back and been affected badly by the situation. Again, they started to look into that and started to build some mobile clinics because, and I'll talk about this in a bit, because security issues, and then they communicated with the international non-governmental organization, we call them INGO, with the UN, with Save the Children, with MSF, to try and come and support them because they have much bigger funds and they're able to carry much more of this health system than just small charities, which they started to do so, and they started to support these hospitals and clinics. And I'll give you an example of how the health system collapsed in these areas. Polio, which has been eradicated worldwide till recently because of the vaccination. In Syria, when the government pulled out, there were no vaccination for children for many years. Polio started again and started to appear as an endemic in the north of Syria. And this is when these NGOs stepped in and said, okay, we need to have a vaccination program, but we can't do it ourselves because these programs controlled by the UN, by the WHO. So they communicated with WHO and then they stepped in and started providing these vaccines to children to try and control polio in these areas. But again, it's a tricky business. Being a doctor or a health care provider in the non-governmental areas, it's like extremely dangerous. Hospitals, clinics are the primary target by airstrikes and military shelling, because they know if you target a hospital and destroy it, the people in that area will leave, they will not stay. They targeted schools, bakeries, and all different things, trying to push people out. And I'm sure you know now we have half of the Syrian population either internally displaced from their homes or refugees in neighboring countries. 10 million refugees is a huge number. These are, crises that the new world has not seen for many, many, many years. And like I said, targeting hospitals is a war crime, and that should be considered, should be treated accordingly. And I remember when I was with David in Aleppo, and when we went several times, our hospital got targeted several times. We used to operate underground because we can't operate above, we'll be hit. You can't go outside the hospital because you've got the government snipers and the high tall buildings just a block away from us, and you can get shot.
I remember reading actually in his book about how they were operating in the basement. I think it was on a little girl, and kind of they said there were airstrikes coming and they had to get out, and actually he stayed to operate. I mean, do you have any stories of you in a situation where you've been kind of targeted or being told to get out because airstrikes are coming?
We get that every day. We get that. You can hear the barrel bombs dropping very close to the houses, to the hospital. You can feel the building, the hospital shakes when you're operating. Once we are operating, we had mass casualty. An area next to us, a building was hit, and we had about 30 or 40 casualties coming through. And then we get the news that, well, the government forces are approaching them just 1 kilometer away from the hospital. So we were operating at that time. Literally, we were treating a young 18-year-old girl who was hit in the chest and in the abdomen. The chest was open, the abdomen was open, trying to stop the bleeding. And you get this news coming through telling you, actually, we have to leave now. The government will be here in half an hour. The government forces and the militia will be here in half an hour. So you can imagine the stress and the amount of fear that you have, because if you get caught, not just you're a medic, you're a Syrian with a British passport, and you can imagine what could happen to you if you get caught. It's going to be a death sentence, definitely. So we're trying to operate on all these patients, and then you get the news, look, you have to leave the hospital. So we continue to work, but we've asked one of our colleagues, look, go and see what's going on, try to find out if they're progressing really towards us, or can we stay to finish and then we can evacuate. We started to evacuate the inpatients on the wards, but the people we were operating on, we couldn't leave them. We continued to operate, and then the guy went ahead, found out that no, actually they were stopped by the opposition forces from coming forward more, and it was okay for us to continue to operate. We used to have calls from there were several hospitals in Aleppo that we operated on. So once we had a call from one of the other hospitals, like about 2 or 3 o'clock in the morning, asking us to go because the surgeon there had a chest injury to one of his patients, and he doesn't know how to deal with these kind of cases. He never opened the chest before. He never did a thoracotomy before. So we had to make a decision in the night to go from one hospital to another. And when I say in the night, that means there's no electricity at all. You've got the Air Force, the helicopters and the army circulating the skies for any kind of flight or ambulance, and they'll target it immediately. So we had to go in a car. One of our colleagues, Syrian local doctors, took us in his car. Pitch black, nothing, you cannot see anything at all in front of you, but he knows the area blindly. He can drive with his eyes closed. He knows the area very well. And we went to that hospital to operate on that chap, and luckily he did really well, discharged home after that to his family. And when we came back again, that's the nice thing, when we came back again after a few months on another mission to Aleppo, he traveled for a few hours to come and say hello to us. It was myself and David, and it was really nice to see that. But again, it's very dangerous business. You get hit, you can get hit, you can get targeted, sniped, kidnapped, or abducted at any time. But someone has to do it. So, the surgeons there really appreciated what we've done and the help they receive, not just from us, from other organizations there working in the field. And you can see they're so eager to learn. And when we came the next time after we finished our mission, you can see the level of expertise that they've developed. They've had a huge leap forward in their practice because, they knew what to do. We sat, we did the training for them, we worked with them, and they were so eager to stay and work in spite of everything. They are the real heroes. The medics working there for years, these are the real heroes of Syria.
And what is the difference between the David Knott Foundation and other charities who already have a medical presence in Syria?
There are a lot of medical organizations who do a wonderful work, wonderful job in these war zones and disaster areas, like MSF. Doctors Without Borders. The issue is these organizations, they go there, they bring their expats, the doctors from our side, they go there for 2 or 3 weeks, a month, operate, and then they go back. What you need really, you need someone to go there and operate, teach the local staff, continue with their communications, and then you can go back again and again to build on this. It's like training doctors here in the UK. It's not just, you need to train them from scratch. You need to build this kind of knowledge and expertise gradually. And don't get me wrong, they're brilliant doctors, they're brilliant surgeons, especially in Syria. The surgeons that we've seen, they're experts with war injuries. But there are certain things they don't know how to do. For example, that surgeon didn't know how to open the chest and do a thoracotomy, which really in trauma, this is one of the basic things that you need to know. But then when he saw how to do that, when he learned how to do that, he was able to do it on other patients and save lives. So yes, I guess I'm not aware of any organization that does similar work to the foundation. Firstly, because it concentrates on both the practical and the training. Secondly, because of the huge expertise of David and the faculty who works with him. David has been doing this work for the last 27 years, I think. There's a huge amount of knowledge and expertise in trauma and war surgery. I've been doing this almost 15 years, so you can get the idea that the team that works with the foundation and with David have been to war zones, have been doing this for quite a bit of time. So they've built this knowledge. In addition, you come back to the UK, you see what are the standards, what are the new things, the developments, and you try to implement them when you go there. Try to teach these standards, try to teach these new things. The doctors there they haven't had any connection with the outside world for years now. Until now, we are still connected. We still communicate with these doctors. We have a WhatsApp group that if they have any case that's an emergency and they need advice, they put it on the WhatsApp group, and we can always support them, tell them what to do, advise them what we suggest kind of treatment or surgery would be appropriate in these cases. So it's like a big worldwide family that we've developed through the foundation and through the work, which is amazing. Would it be different? Definitely the foundation had made a huge difference to the surgeons, like in Syria or in Yemen. Would someone else done the same job? It's difficult to say, but I'm not aware of any organization that does the same thing that the foundation does and carries and have the same David Knott as the foundation has, or the team that works with him.
And how do you think that the damage that has already been done to the healthcare system will affect the health long term for civilians? I guess, for example, in the UK, if someone was to be diagnosed with breast cancer, they'd probably have a mastectomy and then go through a course of chemotherapy and follow-up treatments. Is that available for civilians in Syria?
That's really good question, and I think to say where will the health care system go from now onwards in Syria, it's difficult to say. But let me tell you one thing: the picture is very gloomy. It's very, very bad situation at the moment, and I can't see it improving in the next few years unless you get a proper support to the health system. The health system under the government, I think it will continue to be the same as it is, because unless you have a freely elected government that is democratic, that is caring about its people, things will not improve. For the non-governmental places, similar idea or similar concepts will apply to them too. You need to have financial support, you need to have the expertise to come and develop these training programs, which I think the Syrian doctors are doing at the moment. For example, the areas that are not controlled by the government, they have a council for postgraduate council for doctors, like a specialty council, like we do here in the UK, to train doctors, and then they do the exam and they become a specialist. They started doing that with the help of the doctors, the Syrian doctors in the States, in America, the Syrian doctors in France, the Syrian doctors in the UK, and with the help of organizations like, of course, the Evenmont Foundation. So there's still a lot of work to be done. Chronic cases, like I said, heart disease, diabetes, high blood pressure, all these need to be looked after more. They need a lot of support in that area. Clinics, they need to be run. But again, you need to have a safe environment for these doctors to work and to rebuild the system. Without security, without safety, it will not be rebuilt again. It will continue to run as it is, if not worse, and people will continue to suffer. For example, like you mentioned, cancer. There's no treatment for cancer there. There's no chemotherapy. There's no radiotherapy there. You can do the operation, relieve part of the cancer, take it out, but then after that, you can't do much. So unfortunately, there's a lot of people suffering out there, especially cancer patients, elderly patients, amputees. There's a huge number of amputees because of war, and all these people need support. They've got families they need to look after. They've got children to feed. And again, it's a very difficult situation. And once again, without having security to protect these healthcare workers and their facilities, without having a government that is legitimate and caring for its people and democratic, people can tell them, look, you're doing this wrong, you need to change. I don't think the health system will improve or will be able to cover this huge need in Syria.
And leading on from that, what effect has COVID-19 had on the healthcare system, and how do you think that will impact going forward and in the future?
Gosh, imagine going through war for 10 years, and then after that, you're exhausted, all resources being exhausted, and then COVID comes and hits you really hard. There's, from the medical point of view, they have no idea or very limited experience with COVID. From the equipment and facilities, medical facilities, they're very short of people. And I'll give you an example. For Idlib is a city in the northwest of Syria. It's not under the government control. They have about 100 ventilators for 5 million civilians. So 5 million civilians only have 100 ventilators. Here in the MRI, in Manchester Infirmary, we have 200 ventilators just for Manchester, just for central Manchester. So every 37 to 40,000 people, they have one ventilator. Not just that, 95% of these ventilators are already occupied by war-injured patients. So you can imagine the huge amount of devastation if that has hit these areas in Syria and has hit the people. People are just sitting at home waiting for the time to come, I'm afraid. There's no oxygen, not enough antiviral medications. People who can pay, they can buy it, but the rest, they can't. There is no social distancing. So the spread is huge. They're trying to manage as much as they can. The WHO trying to help as much as they can, but this is all very, very limited. So it has been a huge hit to them. Even the government health or even the government areas. Actually, the Syrian government now denies that they because they only test there. And that will cause more problem for them if they say we have COVID and it's rising. Because that means they need to go into lockdown and close the borders with Lebanon and Iraq and all these areas. So they deny there's COVID there. But we've been speaking to a lot of families in Damascus and the surrounding areas. People literally are dying. People take their loved ones to the hospital, tell them, can you please, treat them, just give them oxygen. They can't breathe. They tell them, sorry, we don't have anything. Go home, go and die home. This is what they've been telling the people when they go to hospital. So it has been a huge impact on the population, on civilians, on the healthcare system. From our point of view, as a Syrian diaspora doctors here in the West, in the UK and the States, we try to communicate with the doctors there, give them advice on how to treat COVID patients, what is the best way, to help people, tell them to isolate, distancing, washing hands, face masks, simple measures. David Knott Foundation, we've been doing regular webinars with people in Yemen, Syria, Iraq, Libya, discussing the new developments in COVID, new developments in treatment, and how, as surgeons, they can implement these treatments in their hospitals, in their field hospitals there. There's so much you can do, but more than that, it's out of your hand, really.
Amar, thank you so much for coming onto the podcast today to talk about Syria and its healthcare system.
Thank you very much for having me.
And finally, I would just like to say a huge thank you to Ala and Amar for speaking to me today, and thank you for listening. Should anyone wish to support the David Knott Foundation, who have helped make this podcast possible, please head to their website to find out more on how to donate at thedavidknottfoundation.com.